Greetings, good morning, good afternoon, or good evening. I am Germán Guerra, and I represent the Latin American Alliance for Global Health at the Global Network for Academic Public Health. It's a great honor to be once here more as a moderator to this 8th session of the course Climate Ready Classrooms, a public health faculty development course on climate change. In this session, we will focus, as it names us, on the building resilient health systems by assessing health systems vulnerabilities. Before we turn to the speakers, I will briefly present the specific objectives of this session and some other important messages. So you can have closed captions of this session. For English speakers, persons should click the closed caption button on the bottom of the window you have in your screen. And para las personas que hablan español, pueden acceder a los subtítulos en español en el enlace del chat que va a aparecer en algunos momentos. So we are now entering the 8th session, and it's, as already mentioned, it's build a resilient health systems by addressing the health systems vulnerabilities. And just to remind which are the overall course objectives of this course is to equip public health faculty with a deep understanding of the science of climate change, its drivers, and its direct and indirect impacts on health, enabling them to confidently integrate climate change concepts into existing public health curricula. And the second objective is to prepare educators to guide students beyond theoretical knowledge towards applied skills in risk assessment, health systems resilience, community engagement, and evidence-based interventions. For this specific session, we have some learning objectives. The first one is to explain how vulnerability and adaptation assessments are used to understand individual, community, and health systems impacts and vulnerabilities, and utilize knowledge of vulnerability and adaptive capacity to explore challenges faced by small and remote health systems. Another objective is to identify risks and vulnerabilities of critical healthcare infrastructure and delivery. A third one is to explore the comprehensive scope of climate change and health surveillance, including health and non-health sector sources, infections and non-infectious diseases, mortality surveillance, and environmental impacts. And finally, is to explain or understand the importance of collaboration on information sharing across departments, ministries, and agencies to support integrated join-up surveillance and its benefits to the individual agencies. So it's really interesting and complex objectives that we are going to touch this session. And for the logistics, as you know, it's a 90-minute sessions. It will include one main lecture from the experts and in this case, we will have 2 case study presentations. The sessions will end with the question and answer section, and please remember to enter your questions in the corresponding box in the Zoom application. These sessions are recorded, and the slides will be made available on the course website. You must be enrolled to the course to access to these resources via Columbia Plus in order to have access to these materials. And to enroll, you have to use the link in the chat. So the attendance, as you know, it's tracked synchronously or asynchronously. We have the synchronous attendance right now. It's automatically recorded when you join the live Zoom sessions using your personal Zoom link. You have to use this link, otherwise it will not be counted as your attendance if you use another colleague's link. And if you watch this recording and it's uploaded to YouTube, it will not count towards your attendance. For the case of asynchronous attendance, you cannot attend live. In case you cannot, you may watch the session recordings on the Columbia Plus Canvas platform, where your viewing will be logged and counted toward your attendance record. Please use the same email that you use for this to have an asynchronous attendance with the email you use for your registration. The certificate of participation will be used to all of those who have attended 8 out of 11 sessions and passed the final exam with a score of above 70%. At the end of the course, they will have awarded the certificate of participation of climate health from the Global Consortium for Climate and Health Education. So you already know there's a WhatsApp group, but if you, in case you have not joined, you can use this QR code to join this group and WhatsApp group. And we will have 3 presenters. We will begin on a 35 minutes presentation with Dr. Barry. He's a senior science advisor on the climate change and health office in Health Canada. Then we will have the first case study by Dr. Pauline Karingu, research medical officer from the Kenya Medical Research Institute. And finally, we will close the case studies with Andrea Sekvor, senior climate officer, climate smart healthcare team at Healthcare Without Harm Europe. So I will stop sharing so Dr. Barry can present, and I will briefly introduce Dr. Barry to this session. So Dr. Peter Berry has been working on climate change and health issues for over 20 years at the Climate Change and Health Office at Health Canada. He has conducted research and published papers in several areas related to climate change, including health risk to Canadians, adaptive capacity, health systems resilience, health vulnerability assessments, and communicating climate change risk to the public. He is currently a senior science advisory at the Climate Change and Health Office and is currently a lecturer at the University of Waterloo, where he delivers a course on building climate resilient health systems in Canada. Peter is involved in a number of national and international collaborations to reduce risk to health and health systems for climate change. He's a coordinating lead author for the next National Climate Change and Health Assessments, which will follow on Health Canada report released in 2022. Health of Canadians in a changing climate, advancing our knowledge for action. He regularly provides expert advice to health authorities within the outside of Canada on preparing for climate change. Among other collaborations, Peter has contributed to the development of a number of guidance documents and expert workshops for partners such as, I suppose it's British Columbia Ministry of Health, the Ministry of Health and Long-Term Care on Ontario, the Pan American Health Organization, the World Meteorological Organization, and the World Health Organization. His current research focus on rapidly scaling up health adaptation to reduce risks for increasing climate change impacts. So Peter, welcome. Thank you for being here, and the floor is yours. Over to you.
Oh, wonderful. Can you hear me and see my slides okay?
Yes, loud and clear, and I can see your slides.
Thank you so much. Well, I'm really excited to be here. Good morning, good afternoon, good evening to everyone. Thank you to the Association of Schools and Programs of Public Health and the Global Consortium on Climate and Health Education and all the partners that organized this really important course. It's really exciting that there's so much more interest by many health professionals on climate change and health. It's such an important issue, and I think it's really great that this session is looking at conducting climate change and health vulnerability and adaptation assessments. They're absolutely critical for getting that knowledge to adapt and move forward. But before I begin my presentation, I just want to acknowledge that I'm actually making this presentation from Ottawa, which is the traditional and unceded territory of the Algonquin and Anishinaabe people. So in the presentation and the time that I have, I'll just remind everybody of the risk to health and health systems from climate change. I know you've covered much of this off, so I'll be very quick with that. Then really focus on climate change and health assessments and some of the steps, how we go through that. And then I conclude with just some observations about education and training to build climate resilient health systems. To that end, I've tried to include in my presentation a lot of links to reports that could be helpful for these kinds of activities that I've found helpful myself. And I should note that I use many Canadian examples in my presentation, but I know there are a lot of great examples from other countries, from other local health units and whatnot that we can all learn from. And so, we know that climate change is here. It's real. It's having impacts on health, and we're going to have to deal with climate change for a number of years. This is a slide that I use for health partners in Canada. In terms of some of the extremes, these are record extreme events in 2023: record ice storm, wildfire smoke, hailstorm, thunderstorm. And what's really, I think, important for me and interesting is this happened all blocks from where I live. And so this is, kind of a wake-up call to me, even having worked in this field for so long, that, look, we really need to be taking action to address climate change impacts on health, because this is happening right now. And, we know this from the Intergovernmental Panel on Climate Change and many other authorities. We've got a lot of evidence of the health impacts of climate change. So we know climate-related illnesses, premature deaths, malnutrition in all its forms, and threats to mental health and well-being are increasing. We know they're projected to increase in the future, but we also know that with timely, proactive, and effective adaptation, many risks to human health and well-being can be reduced. And what's really important is when we undertake our adaptation and greenhouse gas mitigation measures, if they're well designed, we can get really substantial health co-benefits from those actions that build resiliency. And underlying all this is the importance of undertaking climate change and health assessments to really inform these types of measures moving forward. And so this is actually from the Health Canada Climate Change and Health Assessment from 2022. I'll speak a little bit more about that. But it just demonstrates that, certainly, in Canada and other countries, the pathways through which climate change impacts health are really quite complex. We need to understand upstream determinants of exposure and vulnerability, like demographic change and economic growth, urbanization, but also the vulnerability factors at the individual level, like, age and gender, socioeconomic status, and then how they relate to these exposure pathways that we're very concerned about, that I know you've talked about in previous sessions, but also impacts on health systems. This is relatively new and very, very important in terms of how they can be impacted by climate change. So, all of these pathways and all of these considerations need to be taken into account when we undertake climate change and health assessments and when we plan our adaptation measures. And we know, and again, this is relatively new in some jurisdictions. We know that health facilities are being impacted by climate variability and change. So in Canada, we've had wildfires in Western Canada and British Columbia that have affected facilities, have evacuated patients and staff. We've had extreme heat events in the prairies in Saskatchewan that have closed down operating theaters. We've had hurricanes in Atlantic Canada that have affected hospitals, energy systems with flooding, and even in the north with permafrost melt in the far north, we have clinics that are affected. Their infrastructures are actually affected when the permafrost melts. So this is really happening. It's affecting health systems now. And really importantly, we know that we can have very severe health impacts from climate change. I've listed some fairly recent ones that are quite significant in many countries. In Canada, in 2021, we had a really extreme heat wave that in British Columbia that took 619 lives over 5 days. And I think, really important, there was a finding from the Intergovernmental Panel on Climate Change that indicated, the accumulation of these risks to health and to health systems over time can be expected to accelerate, but also lead to declines in community resilience and health. And it could do so in a nonlinear fashion. So, vulnerability could increase quite significantly in health systems. And so we need to think when we do assessments about how can we cover this off and how can we be thinking about this and being able to plan into the future. So, in terms of climate change and health assessments, in Canada, we've actually done them for a number of years now. I think we've done 4 national health assessments, and we've actually known about climate change in terms of possible health impacts for over 50 years. So the first assessment was done in 1997. Then in 2008, we did a very comprehensive one, Health Canada. 2014, and then I mentioned the one that was released in 2022, Health of Canadians in a Changing Climate. And we're now working on our next assessment that will be released in 2028. This is under the report, Living in a Changing Climate, that our colleagues in Natural Resources Canada, they're leading the broader report, and we're inputting health into that from Health Canada. And so this is the report that I mentioned that we released in 2022, Health of Canadians in a Changing Climate, Advancing Our Knowledge for Action. And it may have some chapters that are of interest to you, some new chapters in terms of the reports that we've done in the past, a separate chapter on mental health impacts from climate change, a separate chapter on how climate change affects health equity, something that's of a lot of concern to a lot of health professionals, a separate chapter on climate change and Indigenous people's health in Canada, and a separate chapter on adaptation and health system resilience. How are we doing to adapt in Canada? How is the health system preparing? So some chapters that might be of interest. And we're also learning from a lot of local health authorities in Canada and provincial and territorial health authorities through our Health Adapt program, where we provide support to a number of them to do their own climate change and health assessments. And we've provided quite a bit of guidance, and I'll provide some examples of this guidance in my presentation, a workbook for the Canadian health sector on how to do these climate change and health assessments, a knowledge to action guide, and actually a lessons learned report that we just released based on this program. In terms of some of the challenges doing assessments, but also some of the enablers or some of the opportunities. So that's been really helpful for us to learn and to build that capacity in Canada. Well, this is from the operational framework for building climate resilient health systems and low carbon health systems from the World Health Organization, released in 2023. It just highlights that, assessing climate risk to health and to health systems, and also, the reduction in greenhouse gas emissions is actually a key component of building climate resilient health systems. It's one of the 10 components that the WHO has identified in this framework that is very helpful, I think, for a lot of health authorities. And so some of the other components, include emergency preparedness and management, climate-informed health programs, but also really importantly, a climate-smart health workforce is another really key component of that framework. But certainly undertaking climate change and health assessment is core. And this is a document, this is guidance from the World Health Organization that they released in 2021. We had the real pleasure of contributing to that document along with PAHO and partners. And it outlines the key steps and how to undertake those steps to do an assessment. So, step one is getting started, planning and scoping your assessment, then doing your vulnerability assessment, describing the current burden of climate sensitive health outcomes and vulnerabilities to climate variability and recent climate change. And then saying, well, what's our capacity to actually take action to protect health and the capacity of health relevant systems. But also then in step 4, you need to look forward and say, well, what's going to happen in the future because of climate change? So this is your future risk assessment, qualitatively and or quantitatively projecting health risks of climate change. And then finally, taking all that information and saying, well, what does this mean for what we need to do in terms of new adaptation? How do we identify and prioritize those policies and programs and actions? And then we take all that information and we need to synthesize the assessment into relevant climate change and health policies, plans, and reporting mechanisms. And so I'm going to go through in my presentation these steps in terms of some of the really key actions. But some of the benefits of conducting a climate change and health assessment are really, obviously providing information on current and projected risks to health, but also providing this information to decision makers outside the health sector that we need to take actions as well that are health protective. Transportation, water, energy, they need this information too. The assessments also raise awareness of climate change impacts on health for government officials, researchers, and the public. They build important networks when you do these assessments, but also they can really empower individuals to take needed protective actions, which is really important. And I think this is a really great document because it has some new information that may be of interest to people leading assessments, to health professionals. So, the benefits of Indigenous partnerships and knowledge is in the document. some of the subpopulations that are vulnerable to climate sensitive health outcomes? How do you center health equity in climate change and health assessments? And how do you assess vulnerabilities in health systems and healthcare facilities? Again, something that's relatively new when we undertake these assessments, so really important. And then how do you, what are some of the criteria for identifying the priority adaptation options for your jurisdiction? That can be challenging in an assessment. So there's new information, I think, that's really helpful. And I won't go into this in too much detail, but there's quite a bit of data, tools, and methods for undertaking these science assessments because they're so broad in terms of the kinds of issues. And so you require a lot of different expertise in terms of various quantitative methods that are needed, but also qualitative methods that can be very, very helpful. You know, interviews and focus groups and expert consultations and whatnot. And certainly weaving Indigenous knowledge with Western science is really critical in terms of undertaking these assessments as well. So, you know, in terms of step one, getting started in planning the assessment, this is when you really establish the project team, the management plan, and you include representatives from other departments and ministries, and you really identify those questions to be addressed in the policy context, but also importantly, define the health risks that you're going to look at, the outcomes, the geographical region, and the time period that's going to be the focus. You establish a stakeholder process for moving forward with the project, identify the information and data to inform the assessment, and then develop a communications plan for eventually how are you going to communicate the results of the report. This is really important to do at the beginning. So this is a critical step. This really sets the pathway for the entire assessment moving forward. And in some respects, this can be a very difficult step, particularly for jurisdictions that have not done assessments before. So I mentioned the workbook that we have at Health Canada, and we have a lot of templates and information in that workbook. And so one of the tables that we have is just examples of the kinds of stakeholder groups that you might want to invite to be part of a stakeholder advisory team, or perhaps even on your core team, there may be one or two that's really important. So lots of information that you can use basically to tailor right to your particular circumstances. And I know there are other sources of information like this, but this has been, I think, helpful to health authorities in Canada. So in terms of step one of the challenges for a lot of health authorities is, again, focusing on what are the health risks that we're really going to look at. And so you can use a lot of different sources of information to do that. You can use national, provincial, state, or territorial assessments that have already been conducted, or those that have been conducted in similar neighboring or like communities or jurisdictions. You can use situational assessments, rapid literature reviews, or engagement through surveys, bilateral meetings, or workshops with other government partners. So this is before you really get into doing a lot of analysis. It's really scoping out your project. And in the workbook, the Canadian workbook, we have a template that you can use maybe in a workshop in terms of, well, what are some of the health hazard examples that we might want to focus on? What are some of the indicators around those, on heat or on water, other extremes? Some of the populations of concern, and then you can fill in, the data and information that you need, but also some of the knowledge gaps. So in step two, then we look at, it's our vulnerability assessment. We identify, describe, and prioritize the key climate sensitive health outcomes. We analyze the relationships between current and past weather and climate conditions and health outcomes, and identify trends and upstream drivers of climate sensitive health outcomes and the geographical distribution of risk. And really importantly, we have to identify vulnerable populations and even vulnerable regions, maybe rural or remote regions that might be at particular risk for certain hazards. And then we're going to use this to document baseline information for monitoring changes in future vulnerability. How are some of our adaptation measures performing, for example? And so this can be, as I mentioned before, some of these relationships can be really complex. And so this is actually from our guidance for undertaking, Health Canada's guidance for undertaking heat assessments, heat health assessments. And it just identifies some of those factors at the individual level, like age or income or medications, personal behaviors that affect risk to extreme heat events, or at the community level, like urban design, cooling options, type of housing, local climate, of course, and social networks. And so these different factors interact and can interact in different ways. And so you need to take this into account when you're going through this step in terms of how do you really take this complexity into account. And the WHO document has this really helpful table that highlights some subpopulations that are vulnerable to climate-sensitive health outcomes that can be used. Infants and children, and this is what the evidence is suggesting: pregnant women and newborn infants, older adults and people with chronic medical conditions, impoverished or low socioeconomic status, outdoor workers. So you can use this for your own assessment as a starting point in terms of, well, who are the populations that we really need to focus on in our particular jurisdiction? And then step 3 is really the capacity assessment. As I mentioned, it's identifying those policies, programs, and infrastructures to manage current and climate future health outcomes, assessing the current capacity of the health system to address the risks of climate-sensitive health outcomes. And that's really the key here: is what is our current capacity to do this? And then assessing the current actions of even other sectors that affect risk of climate-sensitive health outcomes. And so, another example from Canada for our national climate change and health assessment, one component of this capacity assessment, we actually did a survey in 2018 of health authorities across Canada. How are they doing in terms of adapting to climate change impacts on health? And it was really interesting what we found out. At that time, there was about only 35% of health authorities had done climate change and health assessments. About 25%, for example, had a dedicated health resource, like a climate change and health office. And interestingly, only 24% at that time were providing climate-informed training for public health professionals. Now, I think these numbers have gone up since then. But that was really helpful to get a sort of a state of where the capacity is, where the current actions are in terms of this. And so many assessments in the past, I think I mentioned this, have not actually looked in detail at the broader health system, healthcare system, and health facilities. And the World Health Organization has come out with this new guidance for climate resilient and environmentally sustainable healthcare facilities that can really help in preparing facilities and informing these assessments. So it's really to guide healthcare professionals to understand and effectively prepare for additional climate health risks, strengthen the capacity to effectively conduct surveillance and monitor some of these impacts on facilities. But it also provides tools and information to assess vulnerability of health facilities, and then to be able to integrate that into broader assessment reports. And so it highlights some of these, really key areas that can be climate sensitive, that are a focus from the health facility level. So, of course, the health workforce is really quite important to look at when you're undertaking assessment and planning those adaptation measures. The operations around water, sanitation, hygiene, healthcare, waste management, energy is really obviously important, and some of the broader infrastructures, technologies, and products, medical supplies that can be impacted during extreme events, for example. And so these are really important areas that could be looked at and should be looked at in terms of these projects. And it's really important to be prepared for future climate change, for these more severe events that are already occurring, and to have your assessments understand what some of these future impacts are. And so, from a facility and health system level, Dr. Chris Ebi developed this method to do stress testing of health systems, and this is where you can use hypothetical scenarios to test the essential functions for providing services to protect health related to current and future climate hazards. So, you can use tabletop exercises where you bring together people and you go through these scenarios and understand what could be some of the gaps based on these scenarios. So this can be a very useful tool for helping with these assessments. And one of the things that was developed by the Canadian Coalition for Green Healthcare here in Canada in terms of health facilities is sort of a set of proposed climate resilient indicator categories for healthcare facilities in Canada. So this can really help these indicators with assessing whether or not facilities are prepared and how they're doing moving forward in terms of that preparedness. This is only part of the table. I couldn't fit the whole table on, but there's indicators around leadership and governance, health workforce. Is the health workforce prepared? Are they aware, educated? But has your facility done a climate change and health assessment? And is it updating it on a regular basis? And there are other categories of indicators that can be helpful. So then in step 4, we do this future risk assessment where we describe how current health risks could change under diverse scenarios of climate change and development, and estimate the possible additional burden of adverse health outcomes due to climate change. Again, really important to look forward and see what could be coming that could really challenge your health system, could challenge individuals in terms of their capacity to adapt. And this is actually from the air chapter in our assessment that really looked at quantifying Canadian air pollution health impacts of a warming climate and the potential health co-benefits of greenhouse gas mitigation pathways. So, answering that question of what would the incremental air pollution health impacts of Canada be in 2050 due to warming, and what this analysis found for the assessment was that we could be looking at annually by 2050, 850 more deaths if we don't reduce or further reductions of precursor emissions. So that's very helpful to understand what the future could bring and to be planning, how to respond moving forward. And certainly, doing some of these future projections can be challenging in terms of, you need to have the health models, the climate service experts, and the appropriate data, the climate data and the health data. It can be sometimes it can be costly, and certainly can take time. But it's very important. But you can also use qualitative assessments as well to undertake these studies. And this was a great example in the WHO document from the Portuguese National Assessment that used storylines of plausible future conditions and risks, and had experts sort of work through those storylines to see what could happen in terms of future infectious disease risk because of a warming climate. So that's another kind of method that can be used and can be quite helpful for understanding future risks. And then in step 5, we undertake the adaptation assessment, where we identify and prioritize policies and programs and actions to address current and projected health risks. So, really focus on prioritizing those health system adaptation policies, which can be challenging in terms of that. And so one may need to estimate the costs of action and inaction, identify the human and financial resources for implementing the identified policies, and try and get that information to understand what's most important to undertake in terms of building climate resilient health systems through these adaptation measures. And we certainly know that we can be successful in terms of protecting health from climate change. This is a finding from the Intergovernmental Panel on Climate Change, from the World Health Organization, and certainly in Canada, our document found this as well. But we need to do this in the right way. We need to design these adaptation measures correctly. And this is why undertaking assessments are so important. And this particular step is really important to do a very good job of in terms of some of the analysis. This is just an interesting example, I think, at the local level in Canada, where Middlesex London Public Health Unit undertook a climate change and health assessment. And they did some really broad stakeholder engagement for this step of the assessment, where they brought, I think, over 100 stakeholders together in a workshop, provided them with the preliminary results from the assessment, and asked some of the organizations, the local organization, how much capacity do you have to be able to respond to climate change? What should be the adaptation measures that would really have practical results and would be really most effective? And they use that with a survey to really understand what some of the best adaptation measures might be moving forward. So that consultation was really quite important. And I think this is a really interesting example from Vietnam climate change and health assessment that took a really systematic approach to prioritizing some of these identified adaptation options by looking at, for example, the technical feasibility of options, the operational feasibility, the effectiveness, environmental acceptance, the financial feasibility, and the social and political acceptance, and really sort of quantifying this to be able to make a decision in terms of the different kinds of options and what should go into their adaptation plan. So they engaged 48 stakeholders, including policymakers, to undertake this exercise. And so in your last step, you want to synthesize the assessment as input into relative climate change health policies, plans, and reporting mechanisms moving forward. And so the other thing that you really need to do is establish an iterative process for managing and monitoring the health risks of climate change and climate resilience of health systems. So this is really important because we're implementing these adaptation plans, and we can't afford to not be effective. We may actually have less resources in the future. We're certainly going to have, in some respects, perhaps less time with some of the extreme events happening. So, really got to make sure that we're monitoring closely and changing course where we need to be more effective in terms of our adaptation options. So I've got on this slide some of the examples from our national assessment of the synthesis products that we developed or partners developed. The National Collaborating Center for Indigenous Health actually developed some really great products, a fact sheet based on the results from the chapter that they led on Indigenous peoples in Canada. We developed fact sheets, Health Canada, but also decision maker briefs that were very short for people, so they didn't have to read the whole assessment given a shortage of time. So this is an example of one of the decision maker briefs for public health units, public health officials, that really provided a snapshot of some of the key findings from the assessment, but also what is their role in terms of adapting from a climate change perspective, collecting and disseminating information on climate change and health, taking action to prevent climate-related diseases, ensuring necessary services are provided, and then, to really help them to understand some of the relevance of the information in the assessment and perhaps how it can be used by them. And so maybe just sort of thinking about that iterative process for monitoring climate change impacts on health and health systems. The WHO developed a report. They've developed a couple of reports, actually, one on measuring the climate resilience of health systems, and a recent report on mapping climate change and health indicators. Which is really interesting because it looks at what are some of the indicators that climate change and health assessments have been using, and what are some of the common indicators, and how can they be used either in assessments moving forward or in developing these evaluation frameworks to ensure that these adaptation measures are successful and your health system is becoming more resilient as time progresses and as impacts increase. So they've got some really interesting categories of indicators or indicators on, the determinants of climate change, global climate change, the hazards. There's indicators on specific hazards, exposure pathway indicators, vulnerability factor indicators. And also, health and well-being indicators in terms of some of the health outcomes of climate change, but also some of the health system outcomes. So I think a really interesting and helpful report when you do your assessment to pull some of this information and really tailor it to your use and your needs as well. And so in terms of the national assessment process in Canada, some of the health assessments, we're very fortunate to have a new document from Natural Resources Canada and from Indigenous researchers and leaders on doing better in a good way, guidance for uplifting Indigenous knowledge systems in Canada. And this is going to be used in the national assessment process moving forward that has best practices for uplifting Indigenous knowledges in every stage of the assessment process. And I think it's going to be really helpful for all of the different reports that are developed in the next series of assessments. So maybe just to conclude with a few observations on education and training to build climate resilient health systems. One of the things I think I mentioned that we did based on our Health Adapt program at Health Canada was try to really understand what were some of the lessons learned, what were the challenges faced by our local and regional health authorities in doing climate change and health assessments, developing adaptation plans, so that we can then kind of focus some of our education and training and networking activities. And so, we found that there were significant challenges around things like data, just capacity to undertake these assessments, the time to take them, funding, and other things. But also some really important enablers of having clear objectives, having broad engagement, more focus on prevention and preparation for some of these events, and then really taking an iterative approach to adaptation. So this is very helpful for us to think about, well, what's the best information that Health Canada can provide in terms of perhaps education and training moving forward. And then just a couple of, I think, really great resources, and there are many resources out there that I'm not including, but this is from the WHO, a country support on climate change and health, a visual guide. And what I think they've done in the visual guide is included in many of these different areas based on their operational framework. A lot of the different types of guidance that they have available, and they kind of explain what the guidance is. So it's kind of a package with all of this in one. And so it's a very useful source, I think, to go through, particularly if you're providing education and training for others on either climate change and health assessments or some of these other activities that are really critical moving forward. And certainly the climate health website from WHO and WMO has got a lot of great information as well that can be pulled from in terms of case studies, created guidance and research documents, and lots of different data and technical resources as well. And then if you have any interest in the next national assessments in Canada, we certainly have information about that and about the process that we go through in terms of the assessment process with partners, providing information and whatnot. So I will leave that with you. And then just maybe a quick reflection on one of the courses that I teach at the University of Waterloo is on climate change and health assessments. And one of the things that I found really helpful and really interesting for me is the method that I use. It's a group dynamic, a group project, where the group actually develops a work plan for undertaking climate change and health assessment, either at a facility or jurisdiction. And this is their main project for the course. And it's been really interesting to learn from the discussions, but also to see how people approach that particular, I guess it's the first step of doing an assessment and learning from that. And so that's been really exciting and very interesting. So with that, I will stop and just say thank you so much for my opportunity to be here today.
Thank you, Professor Berry. For sharing all these resources, I think there's a lot of challenges for healthcare facilities and health systems as a whole to really tackle these really challenging scenarios we will have and we have already been experiencing. So thanks so much and sharing all this resource and all the progress you have made in Canada and other examples you provided. And thank you for keeping track on your time. I mean, do you actually have 2 to 3 minutes? So it went very, very good. Thank you. So now we turn to Dr. Pauline Karingu. She's a medical doctor with a public health specialty, currently serving as research medical officer at the Kenya Medical Research Institute, Wellcome Trust, one of Kenya's leading health research institutions. Her current work focuses on the intersection of climate change and health, assessing the resilience and vulnerabilities of Kenya health systems, and she's involved in conducting vulnerability assessments of primary and secondary referrals hospitals to the growing impacts of climate change. She has previously been involved in research exploring maternal and child health vulnerabilities. Additionally, she has over 7 years of clinical experience as a medical doctor working in Kenya's primary referral district facilities. This experience has given her deep insight into the real-world challenges facing health systems heavily impacted by climate change-related effects. Thank you so much for being here with us, and over to you, Dr. Pauline. Thank you.
Thank you very much, Herman. Please confirm that you can hear me well. Can see my slides.
I can see your slide and I can hear you too.
Thank you. Welcome everyone. Good morning, good afternoon, good evening from wherever you are. Thank you for the introduction, Herman, and I'm here to present on a case study on our training on vulnerability and adaptation assessments in Kenya. So this is the brief outline of what we are supposed to go through, but I'll focus on the training bit as Peter has focused on the vulnerability and adaptation assessments introduction, and therefore I'll continue on the others listed. So this one has been covered extensively by Peter, so allow me to move on to the next slides. And what I want to emphasize is that the vulnerability and adaptation assessments are really a participatory process, and there are so many stakeholders that are involved. No one discipline is able to do the vulnerability and adaptation assessments alone. The risks have also been well discussed by Peter, involving risks to worsening inequity, especially for those that are vulnerable, increased costs of healthcare, in difficulty in access of health facilities, and also ultimately the quality of care that is delivered in the facilities is impacted, especially after an extreme weather event, forcing hospital shutdowns or overcrowding in the facilities. So the WHO provides this framework that outlines the 10 components that are needed to build climate resilient health systems. And among them, and here we can see that vulnerability, capacity, and adaptation assessments is listed as one of the required components to build climate resilient health systems. This is building upon the 6 WHO building blocks for climate and health. So this one has also been well covered by Peter, the steps that are required in conducting a vulnerability assessment. So let me skip that. So I'll go straight to our case study. So this is a case study that was conducted in Kenya, and the plan was to train healthcare workers on the conduct of vulnerability and adaptation assessments. So as a background, Kenya is at the front line of experiencing extreme weather events. As you can see that indicated on the map, we are on the southwestern side bordered by the Indian Ocean, so risks associated with extreme heat and rising sea levels. To our west, we have the lake, so rising lake levels as well. And to the northern region, we have arid and semi-arid region. So we are predisposed to droughts, flooding, and heat wave. So our objective was to determine the infrastructural, operational, and health workforce risks that are posed to health facilities by extreme weather. And for this, we used the WHO checklists. I have provided the link for assessing vulnerability of various hospitals. And here we conducted this study in a coastal county in Kenya to identify the risk of hospitals in that county to extreme weather events. So some of the steps that were involved, of course, I did not list everything, but just a snapshot, is that we needed to choose an appropriate tool or what we would use to conduct the vulnerability and adaptation assessment, which is the WHO checklist. We then needed to have trained staff who will be able to conduct vulnerability and V&As. We also needed to obtain ethical approval as it was part of a larger research project. And we also needed county approvals, County Department of Health and the Research Department approvals, so that we could conduct the study at the county level. And we also needed goodwill and buy-in from the hospital leadership and the management. And all this involved extensive stakeholder engagement, and this involved meetings with hospital managers, county health department, and also as part of the planning process, which was the initial process, we needed the meteorology department to sort of give us a forecast and historical data so that we could better understand what are the risks that we anticipate and what does historical data show with regards to precipitation patterns, humidity patterns, temperature patterns, and such like things. We also needed to train staff to conduct the V&A and do a pilot testing. And at the end, we expected that we would be able to conduct the vulnerability assessments and give a vulnerability report. So the WHO checklist provides 4 domains that are to be assessed when assessing vulnerabilities in health facilities. And these are listed here. We have the water, sanitation, hygiene, and healthcare waste, energy, the health workforce, and infrastructure, technology, products, and processes. Those are the 4 main domains that the WHO checklist focuses on. So for our setting, we had 15 health professionals, and these were working in the health facilities as volunteers, and they were a mix of doctors, nurses, biomedical engineers, and public health professionals. And we conducted a short training that was held for 3 days. Our objectives for this training were to understand, for the trainees to understand the climate change, its impacts on health and health facilities, understand the concept of vulnerability of the health facilities, and ultimately to perform a facility level vulnerability assessment using the WHO checklist. So the approach that was used in the training was a mix of teaching methods, and this included lectures, and lectures were mostly on climate change, what it is, what are extreme weather events, what is the intersection between climate change and health. We then focused a lot on group work so that to understand the checklist as it is. We focused also on simulations and role playing where some of the trainees would act as hospital managers and some as assessors and try to work on the checklist and see if they understood what each aspect of the checklist was entailing. And we also conducted a health facility visit so as to conduct a dry run and see whether they really had the grasp of what the checklist entailed. And throughout all this, we embedded principles of adult learning, focusing more on the peer-to-peer learning and leveraging on their previous experience, because most of them have worked before as medical officers, as clinical officers in the health facilities. So that knowledge was very useful for us in also the training of the vulnerability assessments.
Pauline,
yes?
Pauline, sorry.
Yes.
Can you put your microphone closer to your mouth because it's a little bit closer? Yeah.
Sorry about that. Is it better?
For me, it's good but participants are saying that's very low. And let's try. Okay, continue, please. Sorry.
Okay. Sorry to the participants. I'll try and project my voice. So as with any training program, you need to assess how effective the training program is. And for this, we adopted the MOSE framework that is mostly used in training, in evaluation of medical and other training programs. So this assesses several levels of training, assesses the participation, how many participants did you have, how satisfied were they with the training, with the lectures, and overall how well they enjoyed the training sessions, how much they were able to learn. Here you can assess knowledge before and after. Competence, are they able to do what it is that they are expected to do in a training setting? And then performance, are they able to now do the actual task, that is the vulnerability assessments. We were not able to assess patient health, improvement in patient health and community health outcomes using this framework. So methods that we used to get answers to our levels that we needed to assess included the pilot conduct of the vulnerability assessment. So a pilot visit to the facility assessment was important too. It was important to understand how competent they are in the use of the checklists. Even as they conducted the vulnerability assessments, as this took a period of about a month in the facilities, we had regular check-in meetings and regular just meetings to check on any questions or clarifications that they could have had or any challenges they may have had as they conducted the assessments. They also needed to fill the WHO checklist, and this was important as it showed us how well they were able to do the assessments. And we also had a post-training survey. This was considered that was done after the completion of the assessments. And other modes that you can consider, but we did not use, were pre and post tests for assessment of learning and knowledge acquired. So on our assessment of teaching methods, we found that group discussions and the hospital case study were most preferred for our trainees, and maybe because they were more interactive and there was more peer-to-peer learning in these modes of teaching. And when we assessed learning, we found that at the end of the training period and at the end of the conduct of the assessments, there was an overall increase in knowledge level, with more moving and becoming more knowledgeable and extremely knowledgeable. So our training successes, or what we considered successes for this vulnerability and adaptation training, were that we were able to conduct V&As in 38 facilities, which were purposely selected based on their ecological zones, the extreme weather events that we expected would impact them or were already impacting them, and also their level of provision of care. Some were primary referral centers, others were secondary, and others were primary healthcare centers. So there was also adjunct learning, as some of the team members reported that they now have a clear understanding of research and working in teams. We were able to get a trained pool of healthcare workers who were climate aware, and the good thing is that they were all from the local county, or from the county that we were assessing. So the knowledge and the skill gets to remain within the county. Also, the skill mix was important, and there was a lot of learning, especially from the public health training and the biomedical engineers, and interacting with the doctors and the nurses. Stakeholder collaboration was also a big success for us, especially with the county and county level management team. And also for the health facility manager, they termed it as an eye opener, because most of them actually thought that a pandemic or an outbreak is the most important thing to be preparing for, but they were not considering how even climate change could fuel these outbreaks and could lead to surges or increase in demand in healthcare. So for our training assessment, we also collected feedback on areas that we needed to improve. And some of this were increase the duration of training, as it was reported to be short, considering that the WHO checklist is a really long checklist with assessing various hazards. We were to share the study reading material. Most participants actually appreciate having an idea of what the course or the short training would entail. Have more health facility assessments for the case study. For us, we only had one. And for this pilot case study have a mix of lower level or primary care facilities and higher level referral facilities. Though we had involved many cadres or many groups of health professionals, we left out engineers and architects, and this was something to consider, especially considering that the checklist had questions or areas assessing building code, building designs, ventilation and windows, which healthcare workers may not be very well versed in. Some of the challenges that we encountered when we were conducting the vulnerability assessments, which were aside from the tool itself, we noticed that in some of the facilities, there are very few members of staff. So with a few members of staff getting time to actually sit with them and take time to conduct the assessments, ask some qualitative questions, get some feedback would be quite difficult, especially because they serve large numbers. There is regular staff turnover. Remember this facilities, some of them are in remote and in hard to reach areas, experiencing these extreme weather events and the effects of climate change over time. So there is regular staff turnover. So institutional memory is reduced. So some questions may be requiring you to know something that happened or things that could have happened in the past year, in the last 3 years. Those ones were difficult to get answers to. There are some capacities that are not captured in the formal assessment tools. There are some informal relationships with community members, and these ones may not be captured in the formal tools or in the WHO toolkit or in whatever tool that you may use, as the tools are many. Some of these nuances may not be present and may not be captured, and they are very important for the community. And also, communities are largely organized, especially in the remote areas. They will be organized around a health facility. So we may not be able to quantify the effect of or the impact of climate change and these extreme weather events on the hospitals. If a hospital is submerged, if a hospital is affected by these effects of climate change, there are other effects outside of the facility itself trickling down to the community. Other learnings that were important for us were the need for interagency collaboration to improve public health preparedness. And for this, we were privileged because we are a research institute, so we were able to work on the technical analysis required and ethical approvals. Other important relationships or collaborations are with universities. Most of them are doing a lot of research on vulnerabilities. They may be working on access or something like access to the health facilities and other things that may contribute to vulnerability. So that is very important. Community-based and civil society organizations also have very many projects around raising climate awareness, and we were lucky these were part of our stakeholders in the engagement process. Our community members were also part of the stakeholders that we involved, even as we planned to conduct the assessments, to get their perspectives on what are their priorities, what are their perspectives on climate change. And also the meteorology department, as I had indicated before, they were able to give us historical data and focus so that even as we zone the regions, we are able to know which area is more likely to be affected by extreme heat, which one more likely to be affected by drought and such. So now, considering integrating climate education into teaching and study, or even the vulnerability assessments, because that is our focus for today, we need to map what is in the curriculum, what is present, what is the current curriculum, what does it have with regards to vulnerability assessments, and what are the gaps. We also need to train and build capacity of our faculty members. How trained are they? How much do they know about vulnerability assessments? There's also the issue of interdepartmental collaborations. We noticed that you may have lecturers or even other tutors from the from either built environment or environmental studies and planetary health, veterinary medicine. They may be having the knowledge of vulnerability assessments, as most of them have actually conducted population level vulnerability assessments, but this may not have necessarily been done at the health facility or at the health system level. So this we can borrow from this and learn from these interdepartmental collaborations. Another thing would be working with accreditation bodies. For most medical curriculum, and I say most very cautiously, but considering my context, even in Kenya, the climate change is not really very much covered in the training. So working with accreditation bodies to ensure that courses and training on climate change and health is required for as part of the core competencies, and also co-creation of the curricula with the school curriculum committees to ensure even as they change or even review the curriculum, they include climate change. So the best point of integration will really be guided by the nature of the course, the duration of the course, and other aspects, because it's very context specific. But what to really consider is that when we integrate these theoretical components, it will be important to use localized or regional examples. For example, if I'm teaching about this in Kenya, it will be more relevant to use studies maybe from Uganda, from somewhere near our region, as it doesn't seem of as a far off context happening in other parts of the world and not in our area. For most medical training, there are rural rotations or community health rotations. So these ones are important as they provide first-hand experience with the effects of climate change. There have been some trainings that are linking with as part of continuing professional development, where trainings are partnering with licensing bodies to provide webinars, short courses, and providing continuous professional development points for those who are busy professionals. There are also annual conferences on climate change and health, and these ones are very useful to continue raising awareness and also providing an opportunity for the work that is already ongoing on climate change and health to be showcased. And also there are many free online courses that are offered by the global consortium. I know many of us have attended some of these, but they are very good avenues for training and for learning about climate change and other components of climate change, including adaptation, vulnerability and adaptation assessments.
Dr. Karim, can we please just wrap up because we're over the time now?
Okay.
So
Yeah,
we can just
I'm almost
give the closing
finishing.
remarks, please.
Yes, I'm on the last. So what is the role of higher learning institutions? So it is important to share learning and teaching resources. It is important to attend conferences and share the work that we have been doing. For collaboration, promote collaboration among departments, especially for those offering any online or elective courses. Student exchange programs are also useful, clubs and societies, and also community and outreach and engagement programs. These are very useful for raising climate awareness and cascading the knowledge to the community level. Those are a few of my references, and thank you very much for your time, and thank you for listening to me.
Now we turn to our final case study by Andreas Schekvor. He's a senior climate officer of the Climate Smart Healthcare team at Healthcare Without Harm, Europe. He collaborates on a broad range of climate mitigation initiatives, and his role focuses on developing and implementing strategic approaches to decarbonization within the health systems across Europe. He has a professional background as an environmental management officer at both facility and health systems levels, and he brings extensive experience addressing the challenges that the healthcare sector faces in measuring and reducing greenhouse gas emissions. So thank you, Andreas, for being here with us, and over to you.
Thank you for the introduction. Can you confirm that you can hear me?
Yes, we can.
Perfect, thank you. Following the examples of my co-presenters, good morning, good day, and good evening. As mentioned, I manage Healthcare Without Harm's climate mitigation projects, which include supporting ministries of health, health systems, and healthcare facilities across Europe to calculate, plan, and fundamentally reduce their greenhouse gas emissions. However, today I have the pleasure to share Healthcare Without Harm's work on the steps for building climate resilient health systems based on our work in the projects Mount Adapt and Life Resistal. Before I start the presentation, I would like to thank the Global Network for Academic Public Health and the Global Consortium on Climate and Health Education, as well as the other partners for the invitation to join this important course. To give you a background, Healthcare Without Harm Europe exists to create a sustainable healthcare sector, one that does no harm to patients or our planet. We are fundamentally an international NGO that works to transform healthcare worldwide so that it reduces its environmental footprint. We have regional offices in Europe, Southeast Asia, and the United States. The organization also have staff in various locations in Latin America, and we have a global team. We also work with strategic partners that represent our interest and lead the development of our projects across the world. And if you're interested in engaging with our work, I would recommend contacting the team or the regional team in your region. Several regions offer dedicated regional resources for creating climate resilient health systems. In Europe, we are trialing and scaling new ideas, producing guidance and best case studies, while pushing for ambitious climate policy in 3 different areas: climate smart healthcare, circular healthcare, and safer pharma. We have a global network of hospitals with over 2,200 members who represent over 70,000 hospitals and healthcare centers. But we also have a network for healthcare professionals working towards reducing the environmental impact of healthcare. This includes doctors, nurses, and pharmacists. And as we all know, climate change is the greatest public health threat of the 21st century. But I would like to give you background to the European context. In 2024, Europe experienced its hottest year on record, with more days of dangerous heat and warm nights than almost any year before. Western Europe also faced its most widespread flooding in over a decade. And as mentioned by Peter, extreme weather events like these put enormous pressure on healthcare facilities, and that happens just when people need them the most. Floods, storms, and heat waves can damage hospital buildings, disrupt electricity and water supply, and block access to care. They also bring new health risks, from heat-related illness to the spread of infectious diseases. But the impact, they go beyond the hospital walls. Climate change is disrupting the supply chain of medicines, equipment, and essential services that healthcare depends on. More patients arrive during crisis, stretching staff and resources, often to a breaking point. This further directly affects the physical and well-being of healthcare professionals. And without preparation, these pressures could overwhelm health systems. We have to realize that climate change is an alarming threat, which could lead to total or partial shutdown of health services due to extreme weather events. Healthcare infrastructure is particularly vulnerable, and if we continue along the current emission trajectory, the need for healthcare will increase while health services will be disrupted. Since 2021, Life Resistal, which is an Healthcare Without Harm Europe project, has positioned itself as a groundbreaking project, being able to develop and pioneer the first comprehensive framework for climate resilience in European healthcare facilities. It offers practical tools and guidance to help hospitals and other healthcare services to build climate resilience and be prepared for the impacts of climate change. The Life Resistal project's results have been continued and further developed in MountAdapt, a project that aims to boost community-driven climate resilience in mountainous areas. And today I will briefly introduce a few of the results of these projects, partly the practical guide for building climate resilient health systems, the community of practice methodology, as well as the first 3 models of the Life Resistal toolbox. The 2 main outputs of the Life Resistal project are presented by the Upscaling Adaptation Starting package and the toolbox. The package contains the resources produced by the project's technical partners, such as guides, best practices, and recommendations. It will soon be available on the Life Resistal website. The Life Resistal toolbox is a set of 8 practical modules designed to help healthcare facilities understand, prepare, and adapt to the impacts of climate change. The modules are interconnected, working together as a single powerful resource, guiding hospitals from risk assessment through developing an adaptation plan. And it starts with 3 foundational modules that are the basis of this analysis. The first one is called Infrastructure, Assets and People. It largely concerns gathering essential details about the facility. The second one is Climate Hazards. It's used to derive the climate information and the climate scenario that the risk and vulnerability analysis will be based on. The third one is Risk and Vulnerability, which measures how exposed and sensitive the facility is to these threats. These models that follow the first 3 enable the hospital to estimate the economic costs of inaction and the effectiveness of different measures, while enabling the selection of appropriate strategies and the development of a roadmap for implementation. Today, we are, however, only focusing on the 3 first modules. A fundamental first step, as mentioned by my co-presenters, is to understand the main challenges of climate change and its impact on the healthcare sector and what this means in terms of climate resilience. For this goal, the practical guide for building climate resilient health systems comes in handy because it contains this information and several case studies. An essential next step is to establish a community of practice, which is a network of external stakeholders that can support, especially in the beginning, because they can help strengthen the understanding of climate resilience based on their expertise and experience. The Life Resistal project has developed the Community Approach Replication Guide, which is a methodology for healthcare organizations to establish a local community of practice. And as the timeline on the screen indicates, the involvement of stakeholders is essential, as they can support healthcare facilities in gathering the necessary data and information, but also in priority identification and in designing as well as implementing measures. The results from the practical guide and the community of practice can be considered a preparatory work to address health system vulnerabilities, which corresponds to the content of the first 3 modules of the Life Resistal toolbox. In the first module of the toolbox, again, infrastructure, assets, people, the users will be asked to collect facility background information, describing the more technical dimensions of the facility, which they would like to perform the risk vulnerability analysis on. In the model, they can also define the accepted level of risk, representing the degree of potential loss that the entity considers tolerable. This means the point where risk is low enough that it's preferable not to take action to reduce it. The second module on climate hazards focuses on data collection related to climate information and choosing a climate scenario that the vulnerability and risk analysis will be based on. Currently, the toolbox provides the users with the option of 2 scenarios, a moderate or high emission scenario, which then are used to analyze the outcome of specific climate-related hazards over 3 time spans. Together, this forms the basis for the risk and vulnerability analysis. Based on a specific hazard and a climate scenario, the user can perform the risk and vulnerability assessment. The vulnerability assessment is divided into 4 categories: the health workforce, WASH and healthcare waste, energy, and infrastructure and technology. This process is divided into impact assessment and risk assessment, where impact assessment provides a list of impacts related to the specific hazard, and these are in turn categorized as low, medium, or major. In the risk assessment, the climate information together with the impact itself is combined in the risk matrix based on these 4 categories. These assessments will give you an overview of the level of risk at a given healthcare facility under a specific climate hazard. If you'd like to read more about this, Life Resistal has produced the guidelines to develop vulnerability and risk assessment, which provides a definition of hazard, exposure, and vulnerability, and a framework, and a step-by-step guidance on how to conduct a vulnerability and risk assessment at the healthcare facility level. There are currently 9 healthcare facilities that are testing the vulnerability and risk assessment from Life Resistal and Mount Adapt, and the results of the assessment are still not publicly available, but I would like to highlight just 2 measures that are an outcome of the work of Sergas in Spain. What you can see are 2 images from Spain. Sergas is located in a region where there is a lot of contrast between winter and summer. It's a rainy region, but the rain is concentrated in winter and autumn. Green roofs have been located on the roof of 2 sections of the hospital. This will increase the building's stormwater management capacity and provide isolation, potentially lowering the need for heating and cooling. Consequently, installing a green roof will have double benefits in terms of climate resilience. And of course, in terms of mitigation. The other example is of green pergolas, which will provide shade to employees, visitors, and patients and create a cooling effect. These are just 2 examples, but if you want to learn more about the efforts of our partners, we have recorded several webinars this year, and we recently had the European Healthcare Climate Summit, in which Tyrol Kliniken, among other partners, presented their phenomenal work. And as we see the impact of climate change on patients, communities, and healthcare infrastructure are increasing, healthcare organizations must understand how these impacts are affecting them and which actions are essential to enhance their climate resilience. We at Healthcare Without Harm Europe are working towards making vulnerability and risk assessments more readily available because we see it as a tool that will provide healthcare facilities with a clear overview of their level of risk and vulnerability and allow them to take well-informed decisions, identify priorities, and appropriate measures to remain operational and continue deliver care when it's most needed. Thank you for listening to this short introduction to our work in Life Resistal and Mount Adapt. I hope it provided you with some insights. Please feel free to contact me with any questions regarding our work. I would be glad to disseminate your questions to our project partners. I do want to mention that we do have a lot of case studies and several resources that already are at your disposal. Please go to the website of Mount Adapt or Life Resistal to find them. We additionally have several webinars and seminars that are upcoming. Please follow us on social media and subscribe to our newsletter for more information. Once again, thank you for your attention.
Thank you, Andreas. Very interesting things that you are doing to the infrastructure of the healthcare facilities themselves. So now we turn to the Q&A section. We have roughly 9 minutes. I would like to begin probably with 1 question for each of the presenters. So I would like to start with Professor Berry. We have a question, and it says, have you seen any successful examples of implementations of the enablers you mentioned? For example, how to build buy-in to proceed with climate and health assessments, or increase time in education settings for knowledge sharing?
Sorry, can you just repeat the
Yeah,
question,
sure.
like the last bit of the question?
So it mainly says that some successful example of implementation of the enablers you mentioned. So how to build buy-in to proceed with climate and health assessments, or increase time in education settings for knowledge sharing. So
yeah.
So how to?
Yeah, no, thanks. So I mean, I think our partners in Canada, and we had many Health Adapt partners. So for example, in the province of Ontario, we actually had, I think it was 7 health units in the north come together to do one regional assessment as opposed to 7 separate climate change and health assessments. We had another assessment in the province of British Columbia that was led by First Nations Health Authority. So that was an Indigenous-led one. We had projects that were led by very large cities. So there was a real diversity in terms of the kinds of projects. And then we set up we called it our Health Adapt Community of Practice. I think Andreas mentioned about the community of practice. And so that was really important to share learnings about these enablers and about what works in terms of, and I'll just provide one example. I know we're short of time, but this initiative actually happened during COVID. And so there was a lot of stresses on the people leading these projects, and there were a lot of restrictions in terms of how do you engage people during COVID. And so there was a lot of sharing about, well, how best do you do that? And so having that venue to communicate really helped people share information about these enablers. But I don't want to go into too much more detail because I know we're short of time.
Oh, great, thank you. Now we turn to one question to Dr. Pauline Carignan. So, are there any indicator checklists available to assess specific areas of health interests, such as sexual and reproductive health, in relation to climate change, which can help the policymakers use that information for targeted national adaptation strategies?
Thank you for the question. I may not be very sure about that because it may be outside the scope of what we were doing, as we were mostly considering the health facility itself, but not the population or other factors affecting the demographics of our population. So I may not be very well placed to comment on that, but maybe we can look online and share if we find some. Thank you.
Thank you. Now we have another question, and then we can possibly ask some other question for the panel or something you would like to add. But for Andreas Schakvold, could you please comment on capacity building for health workers to contribute to health systems climate change resilience? So I know your presentation was focused on the facilities themselves, but what about the adaptations or the willingness to healthcare workers to adapt to these changes or to collaborate for any initiatives to change that? Over to you.
I think that's an excellent question and a hard one as well. Our projects, they mainly focus on the facility level, but I think it's important to acknowledge the importance of healthcare professionals. And I think there's a great opportunity here as well to integrate climate adaptation to a greater extent in existing plans. An example would be that there is a lot of emergency plans that already today cover a lot of dimensions related to climate resilience. And theoretically, there's a great potential to integrate climate resilience here to a greater extent, especially when it comes to emergency personnel who are on the ground. And we are seeing more and more examples of this in different facilities. Both related to, mainly one of our partners in our network that I want to mention here would be Yorkshire Ambulance Services, which have done a fantastic work in developing both indicators for climate resilience that are applicable to emergency personnel working in the ambulance service. I think it needs to be very contextual as well, the integration, and you have to know when to integrate and what personnel to integrate. And that is also one of the biggest challenges when it comes to capacity development, because you are working normally with quite complex organizations. And this is a part also of the risk and vulnerability assessment. I'll stop there. I could continue, but I know we don't have a lot of time.
No, thank you. I'm skimming through the questions, and one idea that is frequently coming up is about how do we, in an educational setting, how can we actually start to implement or to train for the VNA, the vulnerability and adaptability assessment in these educational settings? I mean, each of you have somehow show some of their experience, but if you could, each of you give some small tip on what would be the best way to engage with that in the educational setting, so we can start doing this, because I think we do not have too much time in regards with climate change. You know, we have already started to be doing this, right? But it's very complex task because it involves, as all of you said, several sectors involved and willingness to change, etc. So if you could give us some brief ideas that you think that has been more successful in your own experience, that would be great for the purpose of this course. Thank you. Over to you.
I mean, I can just very quickly.
Yeah, sure.
One of the things that I think is really, really important in terms of education and training is actually to take opportunities to participate in these projects. They're very complex and they can be very abstract. And so to be able to actually, either participate or, as I mentioned in the course that I teach, they develop a work plan. I find that that's extremely helpful. It was extremely helpful for me early in my career to actually be able to observe and participate in these types of projects, because then you're on the ground. You're really understanding what the challenges and what the opportunities are in terms.
Great, thank you. Engagement, it's always to take the opportunity to do so. Any other thoughts on that, Professor Pauline or Andreas?
Maybe what I would consider most important is being able to create the linkage between climate change and any observed health effects, because that is really not clear, and also, as has been alluded to, is very complex. So through these projects, whether it's a community engagement project or a project happening in areas affected by extreme weather events, these provide useful opportunities for our healthcare workers, health professionals, and others to really understand the linkage between what is happening, the climate change and extreme weather events, and the effects that we are experiencing. Thank you.
Excellent, thank you. One last thought, Andreas Akvol, on that.
Well, I agree with Pauline completely and Peter. I think it comes down to communication, as mentioned, and making it relevant to the audience. And I do think this is something that we see as a gap currently in how this knowledge is communicated. I think the World Health Organization has taken a fantastic step in developing resources such as the health argument, which really contextualizes the challenge ahead of us.
Great, thank you. And thanks for sharing all your knowledge and all your experiences. It's been a really, really good experience on your presentations too. So for me, I think it's now it's time. We're over 2 minutes. So I'm just going to, I don't know if Daniele wants to close this, but in case she does not, well, I would say that thank you for your time. And we will see you again next Thursday on the 9th session of this course. Thank you.
Thank you. Thank you
Thank
to all the
you.
presenters. And for the participants, the next session, we will talk a little bit more about the final exam that everybody's asking for. Okay. Thank you so much. See you. Bye-bye.